TLIF, transforaminal lumbar interbody fusion. What does that mean? Transforaminal means you go through the foramen, which on the spine, the foramen is this where the nerve comes out under the facet joint. So transforaminal basically means take out the facet joint in order to go between the nerves to get to the disc. The other part, lumbar, means lower back. Interbody fusion means take the disc out and fuse in between the vertebral bodies, which means through the disc space. And the fusion means get the bones to grow together. So the TLIF, which is basically the same as a PLIF. PLIF generally means you save more of the facet joint. TLIF means you take the whole thing out. PLIF requires a little more nerve retraction. TLIF, you come in a little more at an angle, a little bit less nerve retraction, but you've taken one of the joints out, which is a potential area to get the fusion. So the way we do a TLIF typically is we take out the joint, we identify both nerve roots, and then in between the nerves, we take the disc out, clean all the soft tissue out, get all the cartilage out, and then put a spacer into the disc space with bone. A lot of times we'll use the facet joint and that autograft, the patient's own bone, we'll use that bone in the disc space in order to get the bone to grow across the disc space for the solid fusion. So the TLIF is a good surgery because it's pretty fast, because a lot of times you put the screws and rods, these are the pedicle screws and rods, you put the pedicle screws and rods in from the back, and you're able to do the TLIF, put in the spacer through the disc space at the same time, same approach, same incisions, and a lot of times a disc herniation and scar tissue and pathology that's pushing on the nerve, you're working right there, and so you're taking all that out at the same time. So a lot of times it can be the fastest surgery. One of the downsides to the TLIF is that the size of the spacers that go into the disc space are a lot smaller than the other two types of surgeries that we do. The ALIF from the front or the lateral from the side, those spacers are often 2 to 3 times bigger than the TLIF, because the TLIF, you got to work between the nerves, and so the access you have is just smaller. All three of those are good surgeries, and we do all three. Some of the reasons why we do TLIFs, if somebody's very obese to where the ALIF, the anterior approach, is problematic due to the obesity, a TLIF can be a safer surgery. Another one is in somebody who's older, where we don't want to take the potential complications of calcified vessels and maybe they've had previous abdominal surgery and different issues. The TLIF can be the fastest and safest surgery in certain cases. We did a study that showed the TLIF got the least correction of the height of the disc and of the lordosis to correct the deformity that develops with aging. And so when you fuse somebody, you want to correct the deformity because then it puts less stress on the other levels. Because the fusion is going to stop the motion at that level you're operating on, which can put more stress on the other levels because it doesn't move anymore. They have to move twice as much. So at least we really try and correct the deformity if we're going to fuse somebody, and the anterior and the lateral correct deformities better than the TLIF. That's why we tend to do them. But the TLIF is still a good surgery. Our results of doing TLIFs are basically about the same as the other techniques. People's pain typically averages around an 8 out of 10 before the surgery, averages a 3 out of 10 after the surgery. 3 out of 10 is an average, so some people are at a 1, some people are at a 5. But a 3 out of 10 means people still have some pain and stiffness and issues, but they're a lot better than an 8 out of 10, which is before the surgery. So all three surgical techniques, very effective. TLIF is very fast, probably the most common surgery done all over the world, and can really help people. There are potential risks, obviously, with any surgery. The risks that are unique to the TLIF are putting the screws and rods in. If the screw misses a bone, it can hit a nerve. The screws go right down the middle of the pedicle. We use this computer 3D navigated system to put the screws in that makes it much safer and faster and reliable. It's all like playing a video game. We've put in thousands of screws with that. It makes it much safer, but there are still risks with any surgery. Also, retracting the nerves to take the disc out and put the spacer in, there's always a risk for nerve injury, numbness, weakness, pain from the nerve retraction, and even just from the surgery in general. Risk of any anesthetic, stroke, and heart attack and death. So there's always a risk with any surgery, but if somebody's pain is really limiting them, the TLIF is a fast and safe, reproducible way to take the pathology off the nerve, take the pressure off the nerves, and stabilize the segment so that it won't come back. You have two options at this point. If you'd like to come see us in person, please give us a call at 310-448-7890. Or if you want to send us some information by email, we can get back to you. Email us at info@watkinsspine.com. Thank you.